Thank you. And I want to thank Pramila, who without her energy, her focus, and her dedication, we wouldn't be here today, taking us one step closer to getting Medicare for all in the United States of America. And to all of my colleagues, and I want you to look at the diversity from all sorts of, from geographical to how we feel and where we are in the spectrum. If you live in America, you've got a right to affordable quality health care, period. And we have to get it there. You know, this is very personal to me in more than one way. My father-in-law was actually one of the original sponsors of Social Security. And when he finished Social Security with President Roosevelt, I didn't know my father-in-law. I'm obviously younger than my husband. They immediately began to work. They said, okay, we haven't gone far enough. A lot of people said they should have kept going. But they immediately began to work on how you got health care for all. And they never stopped fighting. And when John Dingell came in 1955, he immediately began introducing health care for all. And they made decisions. People say, why does it take so long? It's never going to happen. If you give up, it won't happen. But if you stay at it, it will. And that, I want to say to you, they had a decision. If you go back and read the history, they just had to decide, do we go for children first or seniors first? Well, they went for seniors. And in 1965, we got Medicare for seniors in this country. And you kept fighting. And the next step is we got CHIP for the young children. Well, now the Affordable Care Act was another step. Is it perfect? No. But nobody in this country should worry about whether, if they're sick, they can afford to go to the doctor. If they do go, whether they can afford their medicine, and whether they can afford treatment if it's something like cancer. It is something that when I go to the doctor back home, it's like going to a town hall meeting with John Dingell. And people come up to me. I mean, the last week, a mother of a juvenile diabetes child, 9 years old, said to me, I don't know if my daughter's going to live, if she's going to have a future, if I can't take her. A 50-year-old woman who had had a stroke and was doing okay says, I'm worried about whether I'm going to be able to continue to get medicine. A woman in her 20s that had breast cancer said, what am I going to do? Well, you know what? If you live in America, you shouldn't have to ask anybody those. Every person should be able to get the health care they need. And they need to be able to afford their medicine. And we are all going to fight here, because if you keep fighting, we're going to get it. So Medicare for All will reduce the amount of complexity and overhead in our system by having a single payer. You know, right now, we've got a fragmented health care system. We've got so many players. We've got Medicare, Medicare Advantage, Medicaid, CHIP, each of which varies by state, and TRICARE. We've got hundreds of thousands of different people paying the bills. Well, if we get Medicare for All, we'll reduce costs and have one payer. It'll expand access. It'll improve our ability to negotiate better prices for drugs, procedures, and services. Much is what's done in other industrialized nations. This is a competitive issue. We are the only industrial nation in the world that does not have health care for all, period. Our companies are competing with other countries who are smart enough to have done this a very long time ago. So we're all going to keep in this together. It is now my